Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How can I get a flu vaccine without a needle? Options that are available for a needle-free flu vaccine are the FluMist Quadrivalent nasal spray and the Afluria Quadrivalent vaccine given with the Stratis needle-free jet injector. Check with your healthcare provider to see if you are eligible. About 25% of adults were shown to have a fear of needles in one survey. But do not skip the flu vaccine just because you hate needles, as there are other options. FluMist Quadrivalent. FluMist Quadrivalent is a needle-free flu vaccine that is sprayed up into the nose. No needle is used. It is approved for children and adults ages 2 through 49 years, but there are certain groups that can't use FluMist, so check with your doctor. 2 doses of the nasal flu vaccine, at least 1 month apart, may be required in children 2 through 8 years of age who have never been vaccinated for influenza. FluMist Quadrivalent is not to be used in children under 2 years old because they have an increased risk of wheezing, difficulty with breathing, when using this vaccine. Tell your doctor if you or your child are currently wheezing, or if your child has a history of wheezing if under 5 years old. Learn more. Who can't use FluMist? FluMist Quadrivalent is a live attenuated vaccine, which means it contains live but weakened virus particles. It stimulates the immune system in your nose and throat to help fight off the flu, but it won't give you the flu. It cannot give you the flu. Quadrivalent means it contains the latest version of 4 influenza strains that are known to be circulating for the current flu season. Afluria Quadrivalent plus Stratis needle-free jet injector. Afluria Quadrivalent can be used with the Stratis needle-free jet injector. It's not necessarily pain-free, but it's fast. The device creates a narrow stream of fluid that goes through the skin, without a needle, in 1/10 of 1 second. Afluria is an inactivated influenza vaccine, which means the vaccine is made up of inactivated, killed, viruses that have no ability to infect the lungs. Anyone 18 through 64 years of age who can get Afluria may ask for needle-free Afluria, but check with your doctor, clinic, or pharmacy to be sure they have the jet injector device before you go. Studies have shown that flu protection with the Afluria plus Stratis needle-free jet injector is as effective as getting the Afluria flu vaccine with a needle and syringe. Surveys show that over 90% of patients would choose the needle-free jet injector again and would recommend it to family and friends. Close to 90% of healthcare providers would like to have it as an option in their facility. What if I can't use FluMist or Afluria plus Stratis needle-free jet injector? If you or your child cannot use these options, you may still be able to get a standard influenza shot. Talk to your healthcare provider about this. The Centers for Disease Control and Prevention, CDC, recommends that everyone 6 months and older should receive a yearly flu vaccine. Most people 6 months of age and older are eligible for a flu shot by needle and syringe, so discuss this with your doctor. Tell them you are fearful of needles and ask how to best address this. The soreness from a flu shot is usually a mild and temporary and clears up in a day or 2. This is not all the information you need to know about FluMist, Afluria or the Stratis needle-free jet injector for safe and effective use and does not take the place of your doctor's directions. Review their full product information and discuss this information and any questions you have with your doctor or other healthcare provider, RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.